Some of the challenges we faced in our organization prior to Qventus were surrounding how our care teams were able to connect with one another around the right information. And we saw it really manifest in our capacity constraints in the organization. In particular, long ED waits, our boarding times went up, and just an overall lack of inpatient capacity. Some of the early attempts that we took on to solve those challenges were really around how do we elevate information in our care teams, things like the estimated discharge date, but all of this was manual. It was a manual push and pull from our care teams, and we weren't consistent. We also tried to leverage REHR and Epic to try some of their tools, but again, those were really based off of legacy information that really perpetuated bad habits and old habits, and really didn't push us into the future as to what we could really do to reduce length of stay. So we chose Qventus because we were really looking for a partner that we could work closely with to design solutions that were going to really meet our needs. They showed up and partnered with us through every single stage of the process, in the entire design of it all. And it was really this people process technology approach that I loved about the relationship that we had. The feedback we typically hear from our care teams is they're really excited about all being on the same page. They like knowing the same thing that the provider knows, and the provider likes knowing that the care management team knows the information that's really important to move our patients along. And I think what gets them most excited is they can actually see the results of the work that they're doing. There's a notable improvement in not only their process, but our outcomes in general as well. We've been able to measure the impact that Qventus has helped us drive. Most notably, we've seen a reduction of almost 8,600 excess days removed from our patients and our length of stay. We've seen an 18% reduction in ED boarding and a 7% increase in our discharge volume. And what that tells us is that we're much more efficient in moving our patients through the care continuum, and we're creating capacity, and it's capacity that we're able to backfill with other patients that were otherwise waiting in our emergency departments. So if I was talking to a peer in this field about Qventus, what I would tell them is that you're getting a partner. You're getting somebody that's going to want to design with you. They're not trying to push an out-of-the-box solution to you. It's almost like it's a bespoke solution that you can apply to your teams in your culture at your care sites.